the second session of our Sustainable Healthcare and Climate Health Aotearoa 2020 webinar series. We wanted to thank everyone who attended or presented at our previous session, and also to thank all of the presenters, facilitators, committee members, and current attendees. Today we're discussing a particularly timely subject, a post-COVID equitable, green, and healthy transition, not just recovery. I appreciate that emphasis on transition. A return to the status quo is clearly untenable. The COVID pandemic crystallized the resilience of sustainable systems. Everything from cloth nappies to electric cars to reusable surgical gowns are much more feasible during a shock like a pandemic. And this webinar series is intended to explore how to transition to a more equitable, green, and healthy society. So I'll hand over to Dr. Alex Macmillan to begin her presentation. In order to ask questions, please go via the Q&A icon at the bottom center of the screen, and then I will put some questions to Alex at the end.
Kia ora ra, kia koutou, ngā mihi nunui, kia koutou. Thanks very much for the invitation to present at this great webinar series. Ko Benbecula te mautari, ko Sea of the Hebrides te moana, no Aotearoa, me Ingarani, me Tamaki Makaurau ahau, ko o te puti te kāinga e Nainei. So I live now under the apron of Kaitahu in Dunedin. And I'm a public health physician like Ashley Bloomfield, but without the fangirl following. I work at the University of Otago in preventive and social medicine, and I'm also the co-convener of Aotearoa, the New Zealand Climate and Health Council, an incorporated society of over 700 health professionals concerned in taking action on climate change and climate policy. And what I'm going to do today is provide some context about climate change and public health. We're all public health experts now because of the pandemic. I'm going to link up the pandemic and health and climate justice and provide a sort of a bulky justification for why we've had a coalition of health professional organisations come together and call for an equitable, green and health-centred post-COVID transition. So despite the pandemic, climate change remains our biggest public health threat, with a combination of direct and indirect impacts on public health coming from rising sea levels, increasing CO2 levels and ocean acidification, rising temperatures and more extreme weather. You can see some of those direct impacts in the top left there, and I'm hoping when I point my arrow you can see those as a result of severe weather and extreme heat, and a whole lot more complicated indirect effects through impacts on the ecosystems, water, air quality, and changes in biodiversity and vector ecology and infectious diseases. So both direct impacts and on the environmental and social building blocks of health. And by 2030, globally, we'll be expecting about 250,000 deaths per year estimated from climate change. And that's just counting a very small, limited number of those outcomes on that slide. But just to note as well, if you look over here at these changes in vector ecology, really importantly, that climate change and environmental change underpins the current pandemic and future pandemic because of these changes in our interactions with the environment and with potential vectors. In New Zealand, the immediate and medium-term effects are a bit different from what we might see globally, at least in that immediate to medium term. And really, I'm going to point out 4 closely interlinked effects, and these are mostly indirect. Firstly, effects on mental health, and this is already a big and hidden burden of climate change in New Zealand, but evidenced by the levels of concern and worry demonstrated by young people in joining climate strikes in force, but also connected with some of these other indirect effects that I'll show you. so also as a result of things like livelihood stress, such as the livelihood stress caused by drought, including the drought that's currently affecting Northland and Auckland, causing financial and emotional pressures on farmers, but also on drinking water, while more generally impacts on agriculture through warming and lowering crop yields, drought and extreme rainfall all affect both national and global food supplies. And that's already pushing up food prices, increasing food insecurity and causing food poverty. And food insecurity and food poverty are already a major issue for low-income households in Aotearoa, New Zealand. Speaking of water and water quality, we already have a freshwater crisis in New Zealand. In 2016, we saw New Zealand's largest waterborne outbreak of infectious disease, a Campylobacter outbreak in Havelock North that caused gastroenteritis in more than 5,500 people. And a combination of factors were at play here: land use change, extreme rainfall, probably contributed to by climate change, and poor drinking water management. So water and its impacts are a big part of climate change effects in New Zealand. And of course, extreme rainfall is also already having an impact on housing and health. So if we put floods like this one in 2017 in low-income Edgecombe, add that together with sea level rise and coastal erosion, and then also add in climate-related migration, the result is extreme pressure on an already pressured housing stock. So pressures on housing availability, affordability and quality, all with effects on health, particularly the health of children in overcrowded and damp housing. And no one in public health was surprised when the pandemic lockdown caused a spike in rheumatic fever in Wellington as a result of children being locked down in overcrowded, poor quality housing. And so what I want you to realize from this slide is the importance of intersectionalities, the intersections between fresh water, climate change and housing, but also between climate change, poverty, land use, te tiriti, and existing injustices. Basically, the pandemic and climate change have these really common causes and really common outcomes in terms of environmental disruption underpinning our relationship with vectors and new infectious diseases arising, and that causing social disruption. And we see that social and economic unraveling happening, particularly when things are poorly planned and poorly managed, and health isn't put first and isn't put before before ideas about the economy that are quite limited. And we've seen that in other parts of the world, unfortunately, including places like the US and Brazil. And so this unplanned response we know is likely to be unhealthy and unjust, and we don't want that to be the case with climate change. The response to the pandemic has led to worsening structural injustices, and that's one of the lessons we need to learn for climate policy. It's been really harmful for many, the lockdown, including in New Zealand. Our societal structures and systems were really poorly prepared for the consequences of a pandemic, even though a pandemic has been on the cards for a long time. And likewise, we're currently poorly prepared for the shocks that are likely to come with climate change. And although we didn't see the stark inequities that we're seeing elsewhere, particularly in places like the US, modelling was certainly showing, and our experience with past pandemics were suggesting that Māori would have to about 2.5 times the fatality rate from COVID, while Pacific death rates were expected to be about 1/3 higher. And we know that climate impacts will hit those same communities hardest and first. So poorly planned climate change policies can cause co-harms for health and make health inequalities worse. And that means that including public health expertise, health and social justice, hauora Māori, te tiriti, and oppressed community expertise, including disability communities in climate planning and climate action, is really critical, just like with the pandemic planning and pandemic action. One of the reasons we haven't yet seen these stark inequities is the sovereign actions of iwi Māori public health experts and marae communities during the pandemic, both pressing for strong government action and leading their own action, their own sovereign action, unfunded but much needed to protect Māori communities. And that includes these checkpoints that were set up by iwi in Te Tai Rāwhiti, Te Tai Tokerau, Te Whānau a Apanui, which were really effective at protecting Māori communities. And what we also saw with the pandemic were some glimmers, though, of what's possible when we are forced to change drastically our lifestyles. Although that was really harmful and we wouldn't want to do it in such an unplanned and forced way, we did see some really interesting possibilities, including what happens when our streets can be taken back by people on foot, in wheelchairs, on bicycles, without the noise and danger of lots of car traffic. And people talked about in this lovely report by Women in Urbanism about experiences during the pandemic. People talked about the positive effects on connection with nature, stress from reduced stress from their neighbourhoods being quieter, being able to hear birdsong, connect with people in their communities, and get out and about on foot and on wheels. And globally, what we saw was a 7 to 8% reduction in global emissions as a result of the lockdown. And that's basically what's needed year on year to 2050 if we're going to have a chance of keeping within 1.5 degrees. But what we also know is that these were not systemic changes, and most of this has bounced back. If you look at that graph from Bike Auckland, now in Auckland, the light vehicle travel has now pretty much bounced back to where it was before the lockdown, and that's because there was little in the way of systemic change that went on. Yet we know that well-planned climate action, including a shift towards more active and public transport, can have really big co-benefits for health and well-being and for health equity if it's designed really well. So there's a growing body of evidence about policies and investments that bring high value for money and multi-solve for jobs and climate change and population health and health equity. We can have these win-wins if we decide to do so. But the same Indigenous leadership that we saw in the pandemic will be critical in ensuring that equity occurs. What we also saw really importantly, I think, in the pandemic is the effectiveness of leadership, communicating clearly and honestly and with integrity about COVID as a health crisis, and the government communicating clearly and showing leadership in putting people's health first and responding to expert scientific advice. And that really opens up a huge opportunity for us as a helpful precedent for how we could make an urgent transition in responding to the climate health crisis. And so right now the government is preparing to make this investment of a generation in what it's calling shovel-ready infrastructure, a kind of framing of blokes digging up Papatūānuku, unfortunately, but the biggest investment this government is going to make within the timeframes that we have to act on climate change and have a chance of keeping within 1.5 degrees of warming. And yet, while the fast tracking bill and the purpose of this investment states that it is meant to encourage projects that will promote New Zealanders' future well-being and resilience, and the fast tracking RMA bill to get these investments through clearly states that the project's effects on the social and cultural well-being of current and future generations is one of the matters of consideration. there are no bottom lines for these investments for the environment, for climate and greenhouse gas emissions reductions, or for public health. And certainly public health isn't at the moment one of the areas of expertise that are being sought to consider these projects as they move their way through to approval. And today, the Environment Select Committee released its report on that fast-tracking investment bill and confirmed really that these concerning weaknesses will continue into the bill as it passes through Parliament, despite many submissions to the contrary and quite a lot of advocacy for some bottom lines. So all of these insights that I've been making here about the pandemic and its links with climate change and health came together really in building a coalition of health professional organisations to develop and promote a healthy, green, equitable post-COVID transition plan. And so you can see here that signed onto that plan are all of the major health professional organisations, including the New Zealand Medical Association, the two main nurses organisations, the physicians and the surgeons and the general practitioners and the midwives, and the public health organisations and the anaesthetists and Māori public health organisations. And what we've been asking for collectively to the Ministers of Finance and to the RMA fast tracking bill and the Environment Select Committee are that we put in place some bottom lines for government investment, that as a result of the insights that I've been talking about so far, that we're asking that these investments ensure that they comply with all of the articles of Te Tiriti, that they ensure that we are meeting our responsibilities to both reduce our greenhouse gas emissions and adapt to climate change, that they contribute to enhancing health and well-being and ending inequities and prioritise structurally oppressed communities, and that they improve our economic resilience to shocks, which is something that the pandemic has shown us that our economies are really not prepared for. And that we're saying that projects should be excluded if they result in increased greenhouse gas emissions, or if they clearly will worsen health and social inequities. And we made some specific recommendations across 6 sectors that were based on the evidence for the link between climate change and public health, especially the co-benefits of potential investments. And those sectors included housing and buildings, including recommending a major investment in zero carbon healthy social housing. And we've seen some of that coming through in terms of the announcements around the investments. The obvious things around active transport, electric public transport, and electric rail between cities and freight and for freight. Investments in small and large scale renewable energy, and with a focus on eliminating fuel poverty and encouraging energy equity and energy resilience, and redeploying savings from subsidies of fossil fuel exploration and extraction. Strengthening of the health sector, especially public health, but also the resilience of the health sector, and creating a zero carbon health sector. And making rural investments that help and support farmers to transition towards resilient, plant-based and regenerative agriculture. So those are the very specific recommendations that we've been making to government about a green and equitable, healthy post-COVID recovery, and I'll welcome questions and discussions. Kia ora.
So, Alex, one person is asking if you could say something about responses to date to the recommendations that you've made at various level, not just ministers, but wider within New Zealand. Has it gotten much traction so far?
Yeah, it's had a little bit of attention in the media, and it's quite aligned in many ways to the recommendations that are also being made by both the Climate Change Commission, and it's informed the recommendations that have been made by other climate change groups around the country. The response by Environment Select Committee when it was presented to them was positive, and yet the evidence of its impact on the fast tracking bill is pretty limited at the moment from the report that's come out from Environment Select Committee today. So I think there's a long way to go in pressing government on these bottom lines.
We have several people asking where to find the health professional post-COVID recovery plan.
Yeah, it's a really good, that's a really good, good question. And if there's somebody from Aotearoa on the line, it would be great. I think Julia is on the line. If she could post the link to the website, that would be really helpful. I meant to put it on the slide, and then I think I just left it off by accident.
So one of the things that you mentioned was that unplanned responses, as we've seen with the pandemic, are likely to be unhealthy and unjust, and that is a lesson for climate policy. Can you name some planned policy measures for systemic change that have been successfully implemented elsewhere in the sort of climate change transition domain?
There are loads around the world, and what we're really seeing is that those countries who have got their heads around things like over the past few decades ensuring, for instance, just transitions away from coal, supporting communities to develop other means for economic resilience post-coal in a planned way have seen the benefits in terms of well-being in doing so. There are some examples of that, particularly in Wales. And Wales also has put well-being at the heart of all of its policies and investments, and starting to see the benefits of that. Cities and countries that have been over the last decades in response to a range of drivers, including climate change, investing in walking and cycling infrastructure, are already seeing the well-being benefits of having done so. And we're starting to see some examples, for instance, in the UK, of planned agricultural transition as well. So I think there are really good examples coming from around the world. Another example is China's planned phasing out of coal-fired power stations, and they're doing that in response to a mixture of climate change, but also their huge numbers of deaths from air pollution. And so already saving lives. And so these countries, while they're making these planned transitions, are already feeling the health and health equity benefits of doing that, while we're kind of sloughing away at the and failing to see those benefits, failing to realize those benefits so far.
Someone else asked what we can do as individuals to pressure uptake of your recommendations.
You could take our recommendations and go and talk to your local MP. That's probably the most important thing that you could probably do at this particular point. So yeah, taking the letter and the recommendations and sitting down with your local MP will be incredibly powerful at this point.
Someone was pointing out that the lockdown brought about salutary consequences for public transport, biking, walking, decreases in greenhouse gas emissions, etc. How do we return to these changes? How do we make them permanent?
Yeah, it's really important to note that there were some salutary changes for some people, but that the lockdown has caused incredible harm to a whole range of other people. And what we don't want is for our response to climate change to do that. But those salutary changes need to be locked in through infrastructure investment, through changes to regulation, changing the incentives and disincentives for different kinds of behaviour, but particularly through by not building in by those harmful patterns of behaviour that are also high carbon. Things like road building are particularly unwelcome at this point. Whereas some of the proposed projects include networks of cycling infrastructure and better walking infrastructure, and those things are what are needed to really make sure we lock in some of those salutary things that we saw during the pandemic lockdown.
Several people have asked questions to do with agriculture in New Zealand. One of the recommendations for the rural sector is to transition to more plant-based farming. But New Zealand is highly dependent on exports of animal protein. So what can we do to sort of hasten the transition?
Depends who the we is, really. I think there's a role of a range of different groups here. I think that there needs to be clearer communication with farmers about the drought and what our response to the drought is. The government's support of drought relief needs to have a view to transition. But of course, the industrial agriculture has a huge lobbying power over policy in New Zealand, and we need to match that with some other kinds of lobbying power. And we are hoping with things like our letter, which is signed on by organisations that represent a huge sector of the workforce, the health sector workforce. The organisations who signed on to our letter represent more than 70,000 health workers. That is also a powerful potential lobby group or advocacy group without the same commercial interests. So our interests as health sector workers are in population health and population well-being rather than in our own profits. And so that should be a really powerful advocacy tool. And if there are any rural GPs on the call, then there's a special role for you in talking to your farming families and farming neighbours about agriculture and climate change and health, and agriculture and fresh water and health. And yet we know also that farmers in New Zealand are in huge amounts of debt, and that transition needs to be a supported one that values farming and values food production, and ensures that farmers have their own well-being protected in that transition.
Lovely. Well, we're down to our final minute, so rather than try to squeeze in one last question, in order to finish on time, maybe I'll close here and thank Alex and all of our participants. We had well over 100 participants. Thanks for your insightful questions. And then I just wanted to remind attendees that there's a further webinar in 2 weeks' time. This session's done by Dr. Ruth Large, the chair of the Telehealth Leadership Group, and she'll be presenting on the COVID telehealth boom. So thank you again for everyone who attended, and we'll look forward to seeing you in 2 weeks.
Tēnā koutou katoa.